Okay, so it has got sympathetic, parasympathetic, and somatic nerve. How many nerves are there?
3, ma'am.
3.
Sympathetic, parasympathetic, and somatic. So at the topest portion, you can see the slide on detractor muscle. So what is the effect of these nerves on detractor muscle? So if there will be stimulation of sympathetic nerve, there will be relaxation of detractor muscle, but internal sphincter getting constriction mode. External sphincter is it has completely devoid of sympathetic nerve supply. That means not supplied by the nerve. And what's the function? Filling of urinary bladder. So sympathetic nerve causes filling of urinary bladder. Clear?
Yes, ma'am.
Next is parasympathetic nerve. Okay, it's parasympathetic nerve on the detractor muscle. If there is stimulation of parasympathetic nerve, there will be contraction of detractor muscle. Internal sphincter getting relaxation. External sphincter actually not supplied by the parasympathetic nerve. And what's the function? Emptying of urinary bladder. So sympathetic nerve will carry the sensation of fullness or filling of urinary bladder, whereas the parasympathetic nerve, it causes emptying of urinary bladder. Clear? So what should be the role of somatic nerve? Somatic nerve has no supply on detractor muscle and on the internal sphincter, but it has supply on the external sphincter. Only one nerve supply present on the external sphincter, and if there is a stimulation of somatic nerve, it will cause constriction of the external sphincter. Clear? So what's the function of somatic nerve? Voluntary control of micturition. Voluntary control of micturition. And somatic nerve, actually it causes external sphincter constriction, but the somatic nerve, actually it's under your control. You got my point? So pelvic nerve, sympathetic and pudendal nerve. Pelvic nerve is the parasympathetic nerve, sensory fiber, motor fiber. So sensory fiber, it causes detection of the degree of the stressness of bladder, and motor fiber, parasympathetic, contraction of detractor muscle and relaxation of sphincter as I shown. Then sympathetic fiber derived from the lumbar 2 segment of spinal cord, and it will carry the sensation of fullness of bladder and pain. অনেক সময় মনে হয় না bladder চেপে গেছে, মানে ফিল করছি ব্যথা সেই সময়টা। And pudendal nerve, actually it will supply the external sphincter, that is known as somatic nerve. তাই না? কি বলছি? তাহলে pelvic nerve, in this case it will acting as a mixed nerve. Clear? Has got both sensory and motor fiber. বুঝতে পারছো আমার কথা?
Yes, ma'am.
একজন দুইজন কথা বললে মানে এটা তো ভালো শোনা যায় না। একটা অনলাইন ক্লাস তোমরা রেসপন্স করবে, তাই না? আর তোমরা তো আমাদের নতুন স্টুডেন্ট না, সামনে থেকে কিছুদিনের জন্য আরো লেগেছো, তারপর তো সামনে চলে আসবা। তাহলে I need more voices. তাহলে innervation of urinary bladder and their function. You understand?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Very good. Now micturition reflex or mechanism. So reflex, it has got some component. Number 1 receptor, number 2 afferent nerve, number 3 center, number 4 efferent nerve, and number 5 effector organ. So these are 5 components should be present in a reflex. Okay, so mechanism of micturition reflex, it's an automatic reflex, you know that. Spinal cord reflex, but it will be maintained by the higher brain center. Okay, so when bladder is partially filled with urine, it will stimulate the stress receptor. What is the name of the receptor? Stress receptor. And location of the stress receptors are within the bladder and as well as the posterior urethra. Okay, তাহলে কোথায় কোথায় থাকলো stress receptor? Urinary bladder এর ওয়ালে, especially on the
Urethra.
posterior urethra.
Urethra.
So after partial filling with the urine, it will causes stress stimulation of the stress receptor located on the urinary bladder, as especially posterior urethra. And this sensation, urine is fooling or fullness of the bladder, should be conveyed by which nerve?
Pelvic nerve.
একটু আগেই বলছি কি নার্ভ, এটাকে আমরা পেলভিক নার্ভ না বলে কি বলবো? সিম্প্যাথেটিক বলবো না? Sympathetic nerve. So conduction of this sensation to the sacral segment of the cord by pelvic nerve, more specifically sympathetic nerve. Impulse then reflexly back again to bladder through the parasympathetic nerve fibers by same nerve. তাহলে আমি একটু আগে তোমাদের বলছি পেলভিক নার্ভ কিন্তু এখানে মিক্সড নার্ভ, সেন্সরি মোটর দুটোই ক্যারি করবে, ঠিক আছে? তাহলে পেলভিক নার্ভ একাধারে সেন্সরি আবার মোটর। So impulse then reflexly back again to the bladder through the parasympathetic nerve via same nerve. তাহলে what should be the effect? Parasympathetic effect.
Emptying of the bladder.
Emptying of bladder, fine. So as the bladder continue to fill, the micturition reflex become more frequent, causes greater contraction of the detrusor muscle, which is the action of parasympathetic nerve. Clear?
Yes, ma'am.
Then once micturition reflex become powerful enough, it causes another reflex, and this another reflex passes through the pudendal nerve to the external sphincter. Inhibition of the external sphincter by stimulation of the pudendal nerve, which is known as somatic nerve also. If this inhibition is more potent within the brain, that means if central nervous system allows, then voluntary constricted signals to the external sphincter causes urination. তাহলে আমি কি বলছি দেখো, micturition reflex itself an automatic spinal cord reflex, but it will be maintained by higher brain center. Is it clear to everybody?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
And you know there are some bladder abnormalities. Okay, it's an important slide. So a micturition reflex is a single complete cycle of progressive and rapid increase of pressure. At first, the pressure will be increased, a period of sustained pressure, and return of the pressure to the basal tone of the bladder. So this micturition reflex is single complete cycle of progressive and rapid increase of pressure, a period of sustained pressure, and return of the pressure to the basal tone of bladder. Now the bladder abnormalities, atonic bladder or overflow incontinence, and causes for the atonic bladder are destruction of the sensory nerve fiber. তাহলে destruction of sensory nerve, that means fullness of bladder, this sensation is completely unable to reach to the brain, তাই না?
Yes, ma'am.
যে ব্লাডার যে ফিল হচ্ছে আমি বুঝলামই না, সেই জন্য কি হচ্ছে ওভারফ্লো ইনকন্টিনেন্স। বুঝতে পারছো? ব্লাডার যে আসলো এক সময় ওভারফ্লো করলো, তারপরে গিয়ে মানুষটা বুঝতে পারবে, দেখো, কিন্তু তার আগে বুঝতে পারবে না, বিকজ ডিস্ট্রাকশন অফ সেন্সরি নার্ভ ফাইবার উইল কজ লস অফ sensation of fullness of bladder. So when the sensory nerve fiber getting distracted during crush injury to the sacral region of spinal cord, diseases that causes damage to the dorsal root of spinal cord like syphilis. Syphilis is a very good example. Effect আমি তোমাদের already বলেই ফেলছি, and due to sensory loss, micturition reflex contraction cannot occur.
And the slide is not changing.
It